Hey everybody, welcome back to the I Believe podcast. I'm here with Ashley McCrary, who is 5 years into her metastatic journey, and she is actually 13-ish or more years into her actual ocular melanoma diagnosis. Some of you guys probably recognize her. She's been a frequent guest on the I Believe podcast. So Ashley, thanks so much for coming back.
I'm so glad to be here. Thanks for inviting me. It's always good to talk with you guys.
Yeah, absolutely. And Ashley and I have so much fun chatting. So I hope you guys listening have a blast just listening. Please drop any comments you have in the description. And just know that Ashley is, I mean, she is such a gift to the ocular melanoma community. And I'm going to do my best not to make you cry like right off the bat. But you guys, Ashley has been there for me from like day one. As soon as she found me or I found her on social media, she has made herself more available than I feel like any patient should ever have to make themselves available while dealing with what she has dealt with personally. But she has such a huge heart. And I think that it's because of that huge heart that she is where she is today. And we're going to talk about some of the aid that you guys can get as patients if you are in need of travel assistance. Ashley has one of the organizations that specifically focuses on travel aid. So Ashley, do you want to tell us a little bit about Eye on Grace and what do you guys do? What's your mission?
Absolutely. Thanks for letting me do that. So the Eye on Grace Foundation was started in May of 2024, specifically to help people with ocular melanoma travel for treatment. We think it's extremely important for you to have a companion with you, whether it's a caregiver or a friend, and always good to have a second set of ears. So our foundation decided in the beginning that we would not only sponsor a patient to travel, but also an additional person to go with them. And I thought just out of the gate, we would give the very specifics to it. We sponsor up to $1,000 per person per trip. So to make that easier to understand, if there's two people, we can sponsor up to $2,000 per trip. It's anything travel related that is like flights, gas, Ubers, parking, toll bridges, hotels, things of that nature. We are going back to hopefully a per diem for food starting in January 1st, where it'll be a $20 per meal type of thing. But right now it's just for travel. And we have I guess in 2025, it's been an exceptional year, exceedingly abundantly more than we thought we would be doing. Our goal was to do 500 trips for the year. And as of yesterday, we've done 630 trips. This year, over $325,000 worth of travel grants that have been awarded. And we have just a ton of support in the ocular melanoma community because most of how we get to do this is private donations or donations from pharma and medical device companies. So very excited about that.
Ashley, you're a patient yourself, and you, as far as I know, as long as I have known you, which has basically been the entirety of your metastatic journey, you have been traveling. I think from where you live in the Auburn area.
Auburn area, Auburn,
Yeah,
Alabama.
in Auburn, Alabama. You've been traveling from Auburn, Alabama to Philadelphia, or potentially, have you ever gone anywhere other than Philly for the moment?
Just
Yeah.
Philly.
So it's just been from Auburn to Philly. And I say just because we know, like on a map, that's actually quite a distance. But you do that, or you have done that almost every week for a
Yeah.
very long time, correct?
A long time. So, a couple of things I like to share about my story that I think would be interesting for people to hear is I was diagnosed in 2012, and I was class 2 praying positive, HLA positive, and for those of you in the ocular melanoma world, you know those prognostic indicators would typically say that my cancer could come back within 5 years, but I was extremely fortunate that I went 8 years without metastatic disease. And the reason I wanted to even bring that up is because there's a potentially another resource available, which is the catalyst of how Eye on Grace got started. So on my 8th year, when I was working full time, we had a Aflac group come to our office and share their products with us. Interestingly, I did not think I would qualify for a cancer plan through Aflac. I waited and I asked the person that was in charge, what do you have to do to qualify? Because I had cancer 8 years ago. And she said, actually, in the state of Alabama, if you've been longer than 5 years without metastatic disease, then you could qualify for this cancer indemnity plan. Now, the reason I mention that is that plan is $45 a month. And so I signed up for it literally that day. Didn't even talk to my husband about it, which is extremely unusual. It's not like me at all. I had to go 30 days without a cancer diagnosis for it to be active. So I signed up, paid my first premium August 1st. I had my scans September 29th, so almost 2 months later, and then learned October 1st that the cancer had spread. When that happened and we knew we were going to go to Philadelphia, we looked at the cancer plan, not even knowing, Janae, what it covered. And we learned that it really does, and they like the terminology, bridge the gap, and I do like that. So Aflac will bridge the gap for where insurance drops off. And for me, it would cover for two people to travel and our hotel. And it was enough money sometimes to left over for food. Then when I got on a clinical trial, the trial will pay for some of your, travel, but it doesn't pay for a person to go with you. So where Aflac bridged the gap for me is where the clinical trial dropped off and what it could pay for. Aflac was able to cover for somebody to go with me each time. And there were anyway, it's been over $400,000 that I've been paid out from Aflac for travel and cancer expenses. So I kind of do a commercial for not just them, but if there are other plans that are out there, wherever you live, it's different for every state. So there's a part of me that I want to say, if you're diagnosed with this cancer and you go a period of time, being NED, no evidence of disease with your scans, I say look into it, because if you think it might come back, it would be beneficial. Okay, so that's how this got started. So I had this plan. I was traveling to Philadelphia. I got to meet other people like you, like you and I had met in Philly, and I've met other people. And sometimes the doctors would even say, would you and Dave meet with this family or this couple? And so we had done that over the years. And we had met several that were having GoFundMe accounts that were exhausted, people who had refinanced their house, a family who the husband was a fireman, that they're collecting money at the stop signs and all this stuff. And it just broke my heart, because so many of them were financially devastated from trying to travel for treatment. Even some making the decision of, we're not going to travel because we can't afford that. We can't afford to put our family through that. And it impacted their treatment decision. So in May of 2024, we decided to put this foundation together. I was selling some artwork then, which kind of, I guess, was what we used to fund the treatment. I mean, the travel at first. We thought we would do 2 or 3 a month, and now it's like 20 a month. So the artwork is not what really supports the foundation now, even though it is a small component of it. But that's really how it got started. And I wanted people to know those two factors. One, that you might actually have something offered to you through your work that I think would be worth looking into. I got other supplemental insurance today that I think is important that people don't know about, like critical illness, which paid me $50,000 on my initial diagnosis. That's a supplemental thing that you can just, when you sign up for your benefits. And I got hospital indemnity. And so whenever, and again, that's supplemental, that was not through Aflac, that was through my work. But those three things, those components are something that I wish more people in our community knew to even look for, that were beneficial when I was diagnosed with metastatic disease.
Well, this is news to me. I'm 3 years into a metastatic diagnosis, and so I have no idea if any of this would be beneficial going into like the new year for me for insurance.
Yeah.
But I love what you say about how some of these avenues of support can be a way that the gap is bridged, and that's such a good way to put it, because it can be really devastating to patients to find out that, oh, my health insurance will cover my treatment, but they won't help me get to where I need to get that treatment. And to find these avenues of extra support that already exist, and to just implement them. So let me just to rephrase, you said there was critical illness part of your insurance, and that's your health insurance through your work, right? That was through health insurance at work. And then what was the other part of it?
It's called hospital indemnity, and that usually pays around $1,500 per night anytime you are in the hospital for any type of outpatient or inpatient. If you're staying overnight, it'll pay you $1,500. Usually, most plans do. But
so
again,
is it paying toward the total hospital bill, or is it paying you and your family like up to $1,500 to help with gas, to help with the food, the cost of childcare, for example?
I think
things like
hospital
that.
indemnity, I think that is really more like to help you pay for whatever bills. Yeah, I don't even know, but they give it to you directly. You can use it for whatever.
Like my
Mhm.
situation, I don't work. I work with the Cure Insight, but I don't work in such a way that my income is providing everything. However, my main caregiver is my husband, and he is the
Right.
main provider of our home. And so when he has to take off 2, 3. I think every single Hepzato procedure that I've had to this point, we've now had 3 of those, and every single time he's taken off the day of, the day before, the day after, and the next day. So he's taken off almost a full week of work every single time, and it's great if he has PTO. But I mean, frankly, the way that I look at this, it's not fair. Right? It's not fair for him to have to take PTO and for us to then feel like we are limited and restricted as a family to what we can do as far as like vacation time and just go have fun as a family and make memories. So this is absolutely something that I'm going to look into. I have no idea if it will be beneficial for me in the moment, but I really hope those of you guys listening, especially if you are at the point that Ashley noted, right? If you are new to this diagnosis, your eye was treated, and especially if you're in one of those higher risk classifications. So if you've been told, hey, you've got a pretty high risk of this metastasizing, you're having scans, I don't know, Ashley, what do you think? Every 3 to 6 months? Like at a minimum, you people, you guys in that community, you guys should be looking into these kinds of things. And if you can't do it alone, then find the support that you can to, from your doctor's office. There's social work support. There are resources out there. And I feel like because I don't know, Ashley, maybe you've seen this, but I feel like sometimes because we are told, oh, you're such a rare diagnosis, that we get it in our heads that the American Cancer Society and that some of these larger organizations or just larger things that apply to other cancer patients somehow don't apply to us. And I think it's so important to recognize they do. They still do apply. Critical illness, that applies to a stage 4 cancer patient across the board. Doesn't matter what kind of cancer you have. Critical illness benefits, and then hospital indemnity. And then what was the part that you enacted before you were diagnosed with Mets? That was the AFLAC plan. What was that called?
So, well, the AFLAC plan is called a cancer indemnity plan, and AFLAC is not the only, that's supplemental, and a lot of times those type of plans are offered, like if your business or company brings another company in, like AFLAC. So that's separate, where the things you and I were just talking about, when you go to sign up for your benefits every year, there's going to be supplemental things under there, long-term disability, short-term disability, the critical illness.
I'm just writing these down. So you guys listening, write this down now. Do it with me.
Yeah.
Okay,
and again,
so supplemental.
I didn't know. Yeah. And this is something, if there are people who are listening, that there are 2 of you that are income, that you provide income for your family, where I was working full-time, Dave was working full-time. Yeah. Dave got the same thing on his plans. For example, critical illness. On his supplemental plan, he had a $25,000 for me if I ever had anything happen. So when I was initially diagnosed with metastatic disease, we got a check from my company and a check from his company that was just out of the gate. Here's $75,000 to be able to put toward. We paid off debt, we paid off things so that if I ever didn't work, we would have paid things off. And it was not something I was aware of that you could sign up for, and it's usually not very expensive, and people don't know what it is. And so when you're young like you are, and young like I was 42 when I was diagnosed, why would I sign up for something that seemed like more for older people? But I'm really glad we did, and I wish more people knew about it, because it's such a small monthly payment for something that paid out really big in my life. So those are part of your benefits plan, and typically are just supplemental on your benefits plan. And then the AFLAC cancer indemnity plan was totally separate. Yeah, I've traveled to Philadelphia over 230 times. And the fact that AFLAC has paid for every single trip, every time I've done, that's incredible. And another thing I will tell you about the cancer indemnity plan is they will pay you for other things. For example, if I get nausea medicine, $150 for nausea medicine. The fact that I was on a clinical trial, I got $2,000 a month just for being on a trial, to say, I know that that's hard, and I don't know. And even now I get $2,000 a month just for being on Chemtrack. And I'm not traveling, I'm just here in town. But so the cancer indemnity plan has been, like I said, really, really, really an amazing thing for our family. That being said, that is why we started, because I just knew that we wanted to be able to pay it forward. Not everybody has had the opportunity, because unfortunately sometimes you can't qualify for it if you've been diagnosed with cancer. So you have to go a period of time either cancer free or try to get this before diagnosed with cancer. Like if there's anybody with a freckle out there that thinks they might get an ocular melanoma diagnosis, go ahead and get a cancer plan.
Absolutely.
Yeah.
But like you said, you went a period of time cancer-free as in like your eye was treated, you had your eye enucleated, and then you were considered cancer-free until such point that you did metastasize, right? So that was
Right.
the point that you qualified for this AFLAC plan. So
That's right.
even if it doesn't apply to everyone, like it sounds like it would at least be worth looking into and applying for.
Absolutely.
And if all the qualification is oh, you have to stay cancer-free for 2 months or 6 months or whatever it is, well, I mean, why not? This sounds like it would be life-changing for patients in this kind of position who are higher risk. And to your point, this sounds like the kind of thing that would make it so that Ion Grace can go to the people who need it the absolute most, who are
Right.
in a situation where they're 2 years into metastatic disease, or they apply for something like this and they don't qualify. Because I mean, obviously, that's why we're here. We recognize there are people who won't qualify for these kinds of things, or don't have the insurance benefits, or they're already retired and like they're just living off of retirement. Like there's so many scenarios here
Yeah.
that Ion Grace exists to help to offset and just to bridge the gap between what do
Yeah.
you have and what do you
I
don't.
love that. Yeah, speaking of that, I would love to be able to, kind of address who does qualify for this, and because there are other resources out there that Danae and I are going to talk about in just a minute. But with our organization, I don't know, this is just how I felt about it. When you run your own foundation, you get to make up your own rules, and as long as your board approves them. The way that we started is we said none of us planned on having ocular melanoma. We didn't plan on it from an emotional, physical, health position, and we definitely didn't plan on it from a financial. And even if some people, in order to qualify for travel grants, you have to prove hardship, or you have to prove that you make less than $85,000 a year or something like that. And I can totally understand why those rules are set in place. But with Iron Grace Foundation, we don't look at any finances. We just think the fact that you were diagnosed with ocular melanoma is crappy enough, and
Absolutely.
that we would like to be able to support those. We ask people to consider the fact that we aren't looking at your finances, and so if you could, obviously ask for the things that you need and not necessarily excess. So but I will tell you that as long as you have a diagnosis of ocular melanoma that we can verify, meaning that you send us a doctor's report, an MRI, a Castle diagnostic test, something like that. We have a foundation website. It's iongracefoundation.org. That there's a travel grant application. It's one page. And on that, at the end of that page, you have to submit that whatever your proof of diagnosis is. Then you're immediately approved, and I have an administrator, Dana Hay, that she will send you an email to tell you what you need to do next. And basically, once you travel, you submit your travel reimbursements now on our website and upload any receipts that you have. So if it's a receipt for your flight, or a receipt for your parking, or again the toll, or your Uber, or whatever, and then we pay people back with Venmo, PayPal, or a check. We try to do it. We love Venmo and PayPal because you get it in real time. Checks are fine, but you never know when you're going to get them in the mail. But
Yeah.
so that's how we pay people back. We usually pay back within 2 to 3 days, if not the day of your submission. So it's actually really, really fast, and it's not hard. The learning curve is not hard at all. The other thing we want people to know is sometimes you can't afford your flight.
Yeah, like sometimes you don't have a credit card that covers it. What do you do for people who say don't have a credit card they could put it on and they literally don't have the money in the bank for a flight? A flight cross country could be almost $1,000 a person. It just depends on where you're flying from, the airports, the airline, all of it. And not everybody's going to have that on hand immediately, and not everyone is going to be, able to qualify for a credit card that would allow them to just put it off for a bit.
So we have those people, yeah, they call us, and they'll submit, here's the flight arrangements that we want, and we just pay for it. We've only had one time in the 300 and whatever trips that person was not able to take the trip, but we do the insurance, and we were just able to cancel it on our own card, and it was totally fine. The other thing we do that we prefer to do is, let's say you're going to Philadelphia and you're staying at a hotel. We have relationships with it really any place you want to stay, but we have a current relationship with 4 different places in Philly that our card is on file. That literally
Okay.
we just send them an email that says we're going to make a reservation for Danae Peterson. She'll be checking in on this day and on that day, and charge our card, and they do it. So as long as we know when you're going, we can do that. We try not to be the travel agent, and so our relationship in Philly is different than other places. But let's say that you were going to California for a trip, and you wanted to make a hotel reservation. You would make it, send me the confirmation. I would call that hotel and put our card on file.
Okay, just to make your life easier, then you don't even have to get the hotel reimbursed. It just gets billed directly.
Yeah. Yep. And if you're going to Philadelphia, we have Uber drivers that contract with us that you don't have
Oh,
to,
that's
we give them
wonderful.
your names. You can call them and then they bill us and you don't even have to pay that bill. So sometimes people can get off without having anything come out of their pocket that they have to be reimbursed for that we cover just out of the gate.
Yeah. I think that's so incredible that you guys have been able to network in such a way. And I think just knowing who you are, Ashley, and knowing how much you value connecting with people, I can understand, like, because I remember seeing your posts, like whenever you would travel to Philly on a weekly basis. And I remember seeing your posts of all the people that you met, and they weren't just ocular melanoma patients. You met random strangers that you just connected with. And sorry, I love seeing that you've been able to take all these incredible connections that you've made and you've turned them into something that actually serves not just yourself, but other people. And I
Yeah.
think that that is a gift that you have to observe that and to notice something about someone else and a way that this person could be of service to not just you, but to other people. And to
Wow.
then to then put that out in the world and say, hey, I want you to be our go-to, 3 Uber drivers in the Philly area. And to have the relationship with them already, or to, have established it through other patients, like however the connections came about, I think it speaks volumes to the kind of person that you are, that you're able to
Wow.
build those connections.
That's really been a special thing too, because sometimes, I don't get to meet our travel, we call them travel grant recipients. I don't get to meet them face to face, but I'll go to Philly and I'll see my Uber drivers and they're like, oh, I saw, Mary Smith last week and she looks like she's doing so much better. And I'm like, I've never seen Mary Smith. And that's really cool that you have a friendship with her. And we had a patient that passed away recently that the Uber driver was the last person he spoke to. And he literally at 2 o'clock in the morning knew that he would be out driving, and he texted them, and they had this conversation. And then our sweet little friend passed away at like 2:30, and his last conversation was with the Uber driver. So they're really special people. I know it's kind of a crazy thing. They're special people that we use there. So there was another thing I was going to tell you about. That there are other funds too. Like you brought up a good point a minute ago that sometimes just the flight alone will exhaust the $2,000 that we give. And so one of the things that we have found is that we're going to talk about some other organizations, but I want to talk about Philadelphia in particular. There's a gentleman, and I asked his permission to be able to share his name, but his name is Ken Luker. And Ken has ocular melanoma. He lives in California, and he's been undergoing all kinds of treatments. But he set up a Ken Luker, I guess, fund, that's what it's called in Philadelphia, that is run by Molly Vicina. Molly is the social worker there.
Yeah, I've met her. She's wonderful.
Yeah, she is great. And so sometimes we will call, like this happened just yesterday, where the person's their flight was about $1,900, and if we would have paid for their hotel room, it would have been over the $2,000. So I reached out to Molly and said, "Hey, could you cover this person's hotel with the Ken Luker Fund?" And she said, "Absolutely," and she was able to do that. So anybody can qualify for the Ken Luker Fund. I can't believe I'm saying this. In Philadelphia, you just have to ask. Philly cannot promote it.
Is this fund strictly for ocular melanoma patients, or
Only ocular.
only
Only
ocular melanoma? Because to your point, as far as other hospitals, avenues of financial aid, it's always worth asking. If you're
Yeah.
traveling to a center, and even if you're local and you're going to a medical center regularly, it is always worth asking, do they have any specific financial aid grants or sponsorships, scholarships that they offer to patients like you? And like what I discovered, this was before the Ken Luger Foundation existed, and really before Ion Grace existed. I was traveling for a clinical trial that was adjuvant. I had to travel to Philadelphia from Arizona. It was kind of in the middle of the adjustments post-pandemic. So there was a period when I was able to just get my medicine in the mail. And then that, all the rules and legislation changed and said, you have to travel now to go get your medicine. And so I had to travel at least every 3 months, sometimes more frequently, depending on that. And I remember asking the hospital, just like, do you guys have anything that you can do to support me? And the hospital in Philly had a very specific fund. There was a scholarship for a cancer patient who was under a certain age. And that worked for me maybe because I was under a certain age. So you never know what's out there, because sometimes people make donations to, say, the Sloan Kettering Memorial Center or to the Honor Health Center or to somewhere in California. I mean, everywhere across the country, I am positive that every major cancer center has scholarship programs that are made in memory of someone who passed away, and that they have very specific, kind of similar to what you're saying. The hospital can't promote it, but you can ask about it and you can say, hey, I'm 40. I shouldn't even exist in the cancer community. Do you have any sponsorships or scholarships, grants that I would qualify? The worst they're going to say is, at this time, no, we don't have anything right now. The best they might say is, yeah, actually we do. We have something that is unique to patients like you, or to, I mean, in my local area, there's a company, a nonprofit called Happily Ever After League, and they call themselves the Heal Foundation, and they specifically service mothers with cancer. And so mothers with young children under a certain age. And then I think the other part of it is we've talked about the Bright Spot Network. I mean, there are so many places out there that do their best to serve a very niche community, a very specific group of people, regardless of if they have ocular melanoma. Now, I'm with you, Ashley. Of course, if there's a place that is specific to ocular melanoma where only OM patients qualify, that's going to be one of the best avenues of help for patients. But other avenues do exist, and it's always worth asking and looking and just being aware that they could exist out there. And if you look for them, you might just find them. And in fact, I would argue you will find them.
You will. You will. Matter of fact, one of the things you mentioned, I wanted to tell people why they can't promote it is it would be like what they call cherry picking, which Medicare doesn't allow you. It would be like saying, hey, come here, we've got this special fund, and so that's why you should come to our facility. So they can't. It's not that they're being selfish and don't want to promote it or tell you about it. It's they can't.
It's they would lose their Medicare funding.
Right. But if you ask about it, they can answer. And I guarantee you, like you said, that almost every center, what we call like a center of excellence type of place, will have these type of funds. And the other thing people need to know is that it's very likely that either there's a Hope Lodge or a AstraZeneca Lodge or so I mean, even Philly's got a lodge. It's not close. It's not at all close to the hospital. But there are opportunities like that at a lot of the major places, MSK and Mayo Clinic and things like that. Where there's
And that's something else that we can touch on. And I was really hoping that we were going to be able to have somebody from this organization on. They're listed on A Cure Insight's website. I believe both of these organizations are listed as just avenues that you might find extra support for, specifically for travel. And I've utilized Hosts for Hospitals, and we're going to put these in the show notes. Hosts for Hospitals, I think, is really pretty specific to the Philly area, but I could be wrong. And they have been, a delight to work with. And every time that I ever stayed with someone, I've stayed at a hotel that was sponsored by Hosts for Hospitals. I've stayed in a condominium. This was in the Philly area. But it's worth asking, does Hosts for Hospitals know of, like, especially if you're someone like me who doesn't want to travel to Philly, like, frankly, I don't. Yeah. I don't want that in my life. I have 3 little kids. I don't want to have to travel. And I've done enough in the OM world, just in my profession, to know that there are centers of excellence that treat uveal melanoma and treat it well, that are all over the country. And I know we talk about Philly right now because that's where you've gone the most. Right. And I don't want this to sound at all in our conversation. I don't want this to sound like we're saying you should only go to Philadelphia. Ashley's Eye on Grace Foundation, she will sponsor for you to go anywhere that you are seeking medical treatment. I mean, within reason, I think. But
to your point, I hate to interrupt you, but I want people to know that this is like, even if you're having plaque therapy, I mean, that could be, just 2 hours away from your house. We will cover the gas and
get the gas card.
Exactly. We will cover, we have people in Canada. We have people, as a matter of fact, just yesterday I asked Danet to look at the number of places that we have sponsored people to go, and it's everywhere, from California to Michigan to Indiana, Texas, multiple places in Florida, of course MSK, and even 2 places in Canada. Like, we have people in Canada that go to Princess Margaret or go wherever. We have people in Canada that we're flying to Florida for Hepzato,
for treatment.
It's just, I want people to know it's kind of everywhere.
Does Eye on Grace help with international patients?
We do. We have, I'm trying to think. It's like 6 or 8 people that we've sponsored in Canada. specifically, and those are they seem pretty easy to me. It's train rides, it's, that kind of thing, flights, whatever,
Yeah. No,
from
that's amazing.
Japan. And our
Okay.
sweet friend that lives in Norway, every time she takes a trip, and I know you know who I'm talking about, our friend in Norway, whenever she goes anywhere, yeah, we sponsor her trips as well.
Okay.
And I guess I would like for people to know you can get up to $10,000 per person per year, and then it starts over. And so,
Okay.
because we know that's the other thing is that, unfortunately, like some people will ask me, and I'm sure you've been asked, so how many more treatments do you have?
I
I
don't
mean,
know.
exactly, in our
That'd
world,
be
it's
great if
like,
I knew. I wish I
yeah,
knew.
I wish it was like, hey, you get 5 radiation treatments and you're done, or 6 chemo treatments and you're done. But no, you're on these treatments for sometimes indefinitely.
I mean, you were on Kimtrack for years, right? You were
Yeah,
on a
yeah,
Kimtrack and a Prame trial.
mhm,
I can't remember the name of it, but you were on
yeah.
two different drugs and you went every week for multiple years. I want to say it was over 3 years that I'm
Yeah,
remembering.
right at 4 years, and even with that, I don't mean to get caught up in the weeds, but since you brought up a trial, we have people who are like on the IDE 196 trial. We have people on Prame Tebi trial that their sponsor will pay for most of their travel, but it's not all. And
Okay.
so again, what they do is they'll submit an application to us and they'll say, "This is what IDEA paid us back. We have a gap of three hundred
Here's the gap.
dollars,
Yeah.
and we will pay the difference. We will
Okay.
pay between what IDEA paid and what they paid out of pocket. We will pay the difference." And then the other really cool thing is we want people to be on clinical trials. You and I both want people to be on trials because when they're on trials, then we learn and we're able to pass on. Okay, so there are some clinical trials right now in the United States that are not providing travel for their trial, and we are bridging that gap. They know about us. Yeah, the people of Quisinistat, I can't even say it. Quinistat, whatever it is. Anyway, that's in Miami. A dozen people that we're sponsoring
Okay.
their groups.
Question.
Yes. Okay.
Okay. Do you know about the Compass trial?
I do not.
Okay, so the Compass trial is for it's for early treatment like of ocular melanoma for very small lesions, and the way that, and nobody quote me, I could be slightly incorrect, but I'm fairly certain that once you're on the trial, this Compass trial will cover your travel to go, however many times you need to go for this treatment. It's a very unique type of treatment. It's not laser. It uses a laser, but it's an injection that then is activated by a laser, and it preserves the healthy vision of the eye as much as possible. And it's a really, really amazing thing. But they don't cover the travel for someone to, say, go from, I don't know, Arizona to Idaho, if that's where the treatment is happening, and I need to go be evaluated and find out, do I, as a patient with this tiny tumor that needs treated, do I qualify for that trial? So this would be a really, really, honestly, I'm just using this as an example, but this would be a really unique way to bridge that gap, because
Yes.
then we don't have the excuse, or the, not, I don't want to say excuse, we don't have the reason to pull back from, say, enrolling in that trial, because they're not going to cover my treatment, or they're only going to cover my treatment travel. They're not going to cover my evaluation travel. If
Right.
you're going to be evaluated for a clinical trial that says we have to check a few things to see if you qualify to do this trial, it sounds like you guys would be able to bridge that gap because it's treatment related travel.
And if, sometimes that's happened with people who they have to go back for their scans. So their
Yeah,
scan
absolutely.
travel's not covered, which that makes no sense to me.
It doesn't make
And,
any sense. You can't
and
be
yet
on
we
the
will cover
trial
that.
if you don't have
Right.
regular scans. Like the arbitrary things that come up are such a nuisance for us as patients. And
Yeah.
you have such a unique perspective on that because you've been in the middle of it. And while, yes, you've had the AFLAC plan, you've had all of these other things that you were in a position and just learned enough about them soon enough to be able to implement them for yourself. You also have dealt with so much personally, and you have a really strong insight into the rest of the community because you connect so well and so easily with so many patients across the world. Seek your help, seek your advice, who just need somebody to talk to, and you're just one human being. I know how much you do, and I know how hard it is. I mean, I know how hard it is on me. I can only imagine how hard it is on you. Like, I just got back from the I Believe conference, and I host that
Yeah.
whole conference. And I mean, you guys, I spend the entire weekend, basically all day Thursday, all day Friday, and all day Saturday. And I got cumulative less than 10 hours of sleep between all 3 of those days because I was up working so hard trying to make sure that everything went well. And
Right.
we care so much. Like, when we are in this and we are part of an advocacy organization, or we are, like in Ashley's case, founding a foundation that is going to I mean, it's going to be immortalized. It will never go away. Like, this is the kind of foundation that will exist long after, I mean, long after you get to be 90 years old and
I hope so.
pass away from something that is not
Not
ocular melanoma. We're going to put that out in the universe.
right, right,
And
right.
I just think
That's
that
our
it's
hope.
so incredible for this to be a legacy that you're living and leaving.
Wow, I know we it's so humbling every day because I say, we stand on thousands of shoulders. We
Yeah.
get, I mean, for it to be mostly private donations like you guys, that is how it's funded. I get checks in the mail every day, literally every
Yeah.
day. Or you could donate on our website, theiongracefoundation.org. And I try to tell people, you don't have to donate, this something big. It could be $25, it could be $25 a month. And that just adds up. I mean, that's somebody's
Yeah.
gas, that's somebody's toll, that's somebody's Uber drive. And then so people ask me all the time, like, about how much is it for a person to travel? And you and I both know if it's two people, easily it's a $1,500,
Yeah,
with
for
food
sure.
and everything,
Even just me
easily.
going to California, like when
Yeah,
I traveled to California, I live in Arizona. I'm next door. And just for me and my husband to fly to California instead of drive so that it was less physically, strenuous and taxing on my body, it was about 1,500 total between hotel
right.
and flight. And that was just two of us.
Right. And when you think of that, the sweet people who have to go, our IDE 196 people, they're going every 3 weeks. You think about your
Mhm.
IE people, they're going once a month. And then you've got the scans and all the other things. It just adds up. And so,
Yeah, it does.
yes, for all the people who donate, it is amazing to see what has been able to happen with it. I mean, these are life sustaining, potentially life saving moments. I know Sophie won't mind me sharing because she's been so gracious, but like Sophie Stevens going to get TIL treatment and it's worked so well for her. Those are very expensive trips. And so
Yeah.
in her situation, not only was she able to look into what we could cover, but I think this would be a good time for us to talk about what other options are out there. And
Yeah,
there's another
absolutely.
foundation that I think a lot of, it's kind of newer on to me, it's newer on our platforms. It keeps coming up, but it's the Christine Fox Frauenheim. So CFF, Christine Fox, if you just Google that,
Okay.
her foundation will come up. And she passed away a few years ago. She had done Chemtrack for a while, but her husband and her brother, or it's her husband's brother, I can't remember, but they run this foundation. And I have been able to say, we can't cover this whole trip, but could y'all cover
Could you
this
help?
whatever?
Yeah.
And they do, and they also will cover other things like the Cure and Sight does this as well. So people need to know Cure and Sight has a travel fund that you can apply for, but y'all also will cover things that I can't cover. Like my bylaws strictly state, I've had people ask me, could you cover my,
My mortgage or
yeah,
my,
or
yeah,
water
like, I mean,
bill
I'm just
or
giving an
whatever.
example, yeah, of
Yeah,
something
and
that a
we
Cure
can't do
Insight will
that.
help to cover specifically.
Yes, and the Fraunheim, the Christine Fox Foundation, they could do that as well. If you have a need, they can help meet that need. I can't do
Yeah.
that. So, but that organization, I do know, and you and I've talked about that OMF, which is Ocular Melanoma Foundation, they have on their website a place. I'm not sure how active that travel grant process is. But again, there's other organizations. I want to say that MRF through CureOM has a travel grant process
Yeah, they
that you
have
can
some degree
do.
of aid. I don't remember the exact process. I just know it
Neither.
exists. And
Yeah.
similar to, I mean, I guess I can only speak to a cure insight. And so to your point, like a cure insight cannot cover everything either. And a
Yeah.
cure insight is because, and I want to explain this for people. Ashley's foundation, the Christine Fox,
Mm-hmm.
I'm saying it, the CFF,
Frauenheim. Yes.
Frauenheim, Christine Fox Frauenheim Foundation, they exist to meet a very specific need. And A Cure in Sight is the largest patient advocacy organization, the most active patient advocacy organization in the world for ocular melanoma
Yeah.
specifically. And while we
Couldn't.
do have financial aid, we also fund research. We also host 5Ks and help gather research funds for local doctors, like say Dr. Prithvi Murthy at Stanford Byers Eye. Like if they raise $50,000, we say, okay, Dr. Prithvi, like you get half the funds to go to your own research at this facility for ocular melanoma. So we are really far far-reaching in the types of assistance and the types of resources that we offer here at Ocular Insight. We have sponsorships that help to fund like this, our podcast. We have sponsorships that are helping to pay for the cost of production, because it does cost money to produce a podcast episode, to have it professionally edited, and then to put it out there in the world. Our conferences, the I Believe conferences, and those of you guys who attended the I Believe conference this year, you got to see that we were privileged enough to have support from Eye on Grace to help people to travel to the I Believe conference. Ashley and Melody, who's the founder of Ocular Insight, were able to come together and collaborate. And I think that it is so important that people recognize that, yes, Eye on Grace is here, right? And the CFF Foundation is here. And some of these very unique travel-specific foundations do exist, but please don't let that deter you from applying, especially if you're in a far more dire situation and you max out. Because, I mean, I don't know how quickly $20,000 could be used up, but I can imagine if you're traveling every week, it'll go quick. I mean, I think, Ashley, you would probably know better than anyone because you used to travel every single week. So if you can imagine, say, $1,500, so $3,000 in flights times 52, I'm pretty sure that's going to be more than $20,000. Like I'm pretty sure.
Yeah, absolutely. Absolutely.
So,
that's
I mean,
hard.
it's so important that you guys listening recognize we are not in competition with each other. And Ashley, you've talked about this before. We are not in competition with each other. Ashley wants Ocular Insight to continue to succeed and to raise funds and to be able to have what we need to serve the patient community as much as we want her to be able to serve the patient community. And we each do that in very unique ways. Ashley does it in a very specific way through Eye on Grace, and Ocular Insight does it in kind of a mixture of ways, and those ways all have a very significant impact in different ways, financial or otherwise. So I'm just going to piggyback on what you said, because I do think it is important that we recognize as well, if you are donating on a monthly basis, say you've taken the challenge from Ashley, right? And you're donating $25 on a monthly basis to Eye on Grace or to some specific foundation that very specifically funds travel, and you're willing, I just want to dispel a myth. I think that's what I want to do. Because I think that there's a myth in donating to an organization that does more widespread things, right? Like Ocular Insight, we have lots of programs. I think there's a myth that like somehow we decide exactly what to do, with the money. And I say we, but like the board of Ocular Insight. Here's the thing. If you make a donation on Ocular Insight's website, and you go in and you put in the notes, I want this to go specifically to travel aid or to financial aid only for like serving the patient community directly, then we honor that. Like, I mean, that's what it goes. It's like a contract. It goes in writing, and the money you say you want to go to, say, research, it goes to the research bucket. And so you can designate where you want your funds to go. It makes it easy in some place like with Eye on Grace. It's super easy because there's just one bucket, right? It's the travel bucket. Right. But if you want your money, say you have the ability to donate $50 and you want half of it to go to research and half of it to go to Ocular Insight's financial aid program to directly help patients with travel or their hospital bill, we have the ability to fund whatever need or to reimburse whatever need up to a certain point. We have a cap each year depending on how much money we raise. But I want to be a little blunt and just say, if you have decided that you're only going to donate to one organization that is only funding travel, then you're going to see a drop off in these other organizations that have the ability to meet other needs aside from just travel, like to help pay your mortgage or to pay an electrical bill, to help pay for your groceries. Like, other organizations have different limitations, and they can help each other bridge gaps, right? Because like you said, you can't do everything. Eye on Grace cannot do more than just travel. And so we want to bridge the gaps together. And I want you guys listening to know that we want each other to succeed. And I truly believe that if we have people who are willing to donate $100 on a monthly basis, that it's not going to do any kind of a disservice to say, okay, sure, I'm going to donate that, but I'm going to split it 3 ways or 5 ways, or I'm going to donate $100 to each organization. Like, there's no wrong answer here, guys. If all you can do is $20 a month, like making that regular donation and making it a recurring donation, like Ashley suggested, to go to any of these organizations that you want to support, it makes the world of a difference. And it's like you said, Ashley, it can be the difference between somebody having the gas money that they need to actually get from place to place, or the tiny little bit that's going to bridge the gap in, can we cover the whole hotel bill or just a portion of it? So please don't underestimate the ability of yourself to make an impact, even if your donation and your contribution to us as different organizations is small.
I think that's a really good point. And just to show you how seriously I take it, I personally make contributions to a Cure in Sight pretty
Thank you.
regularly throughout the year. And, or, if somebody's having a birthday fundraiser for a Cure in Sight, I'll
Yeah,
probably be one
absolutely.
of the first people to go toward that. I
Birthday
think those are great.
fundraisers. One of the only good things for Facebook these days, right?
Yeah. So the only other thing I think you and I said that we want to talk about that we hadn't, but is worth mentioning is Danae's going to have something that's attached to this. It's another resource page, and one of the things that I've appreciated, for example, there's a sweet girl Cassie person. That she lives in Lower Alabama, and she uses Pilots for Christ to fly her to Philly when she goes up there, and then she uses us for her apartment. I mean, not her apartment, her hotel. And she has set that up. So there are different organizations that helps with flights. There's Skyhope. There's, of course, like I said, Pilots
Angel's
for Christ,
Flight, I think.
Angel Flight. And so, again, they have their own process. But I actually appreciate it when people say, you know what, we've got our flight covered.
I mean, the flight can be the biggest expense, right? Like, I mean, the flight really can be the biggest part of the expense.
It's something we're looking into right now. It is a huge process, but with every airline, we are filling out an application for us to be able to, for you to be able to donate your miles, for example, back to Delta Sky Miles, and us be able to go in and use that. But then you may know somebody, Danae, that actually has Sky Miles. They can donate them directly to you. And
Oh, okay.
there are people who can do that. And so I was just going to tell people, like, you may know somebody who flies corporately for their work, that they've got more Sky Miles. You can imagine how many Sky Miles I have.
I can imagine. I mean, I'm sure
It's
it's a lot.
significant. Okay. So, knowing how many I have, there are people who do just like me, but they travel for work. And so I think, why not approach somebody like that? Hey, would you like to make a donation to my
Yeah.
travel
I mean,
with your
once you get
Sky
that
Miles?
up and running, please share it with us because that
I
is
will. And
phenomenal.
it's something that I'm going to go ahead and tell you. Every airline has something like it, and it is buried. You have to dig to find it.
Yeah.
But it is an application process that they can say, yes, people can donate. Like you could call up Delta now and say, I would like to donate mine to the Eye of Grace Foundation, and we would be able to utilize that.
I guess let's give a specific example. Let's say you're a flight attendant, or you have, I don't know, your sister is a flight attendant, and she accumulates
Yes.
miles from just because she's an employee, because she flies maybe a little more often than the average person. Let's say she accumulates, I don't know, 50,000 miles, 50,000 flight miles. And that's frankly, that's probably a low number, to be
Yeah, that is a
honest.
low number. Yeah. But
That's a
that would
pretty low
cover a
number.
trip. That
But
would
that
cover
would
a
cover
trip.
one person's round trip flight for the most part. I
Yeah,
mean,
it
depending on
would.
the airline. And I think that'll be a really unique resource. And to your point about all of these resources, like you guys listening, we've talked about a lot. And I personally, I mean, I know that some things, especially if I'm listening to a podcast, like say while I'm doing the dishes or while I'm driving, please be safe while you're driving. Like don't be looking at stuff while you're driving. But
Yeah.
if you're listening to this and you're kind of doing other things, please know that I'm going to do everything that I can to put this together in a shareable way. My plan actually in talking with you is that what I'm going to do is I'm going to make a Canva PDF. And so it's going
Yeah.
to have all the travel resources listed. We will list this on our website, on Kieran Site's website, where we can like link it. We'll put it out in the newsletter. We'll put it out on social media. I'm making all these promises. So Megan, like who's also a social media person, she's going to be listening and be like, okay, Danae, okay, we're doing that. Anyway, but we want this to get out there to people because
Yeah.
like you said, Ashley, like there would be so much alleviated for the mental and the emotional, the financial load on each patient and their families if we just could make these connections. And sometimes we're too far in the pit of despair to make these connections ourselves.
Right.
So
Yeah.
I'm so glad that people like you exist who are willing to talk about this and just put it out there that there are resources and we want you to find them, not just the ones that are important to us because Ashley founded Eye on Grace or because Melody founded A Cure in Sight. We want you to find all the available resources to you. So we're
Right.
going to do our best to make that list of resources, include some interactive links on the PDF. And if you are someone listening to this episode and you hear or you know of something specific
Please.
that we haven't covered, then please tell us. List it in the comments. Send us an email. You can send an email to contact@acureInsight.org. We would love to know. And if you have specific connections you think would be helpful for Ashley with the Eye on Grace Foundation, then Ashley, what's the best email for them to contact you?
So we're like y'all. We're now at info@iongracefoundation.org. And I would say I would love for people to send stuff like that because you brought up something earlier. For one, I always tell people when I have our initial conversation with them, I don't want to overpromise and underdeliver. I don't want to tell you that we can cover all this and you make all these grand plans and us not have the money. And y'all, in the month of July alone, we paid out over $40,000 in travel grants. And I would be lying if I said that did not cause me to pause because I thought, are we going to have the amount of money coming in that we are going to have going out? And fortunately, we do. But it could be a reason if this got out and I'm sponsoring everybody and their brother. Do we have enough money coming in? So when people go and tell us, hey, there's this resource that can free up money for other people to use, I appreciate that. I do. I appreciate that because I'm like you're thinking of others, and I appreciate it.
It's so
Yeah.
important that we get creative with this, I
Yeah.
think. Because to your point, it's not just the goal here is not just throw money wherever we think we should throw money. And I
Right.
say that kind of casually, but like you said, if there's $2,000 total per trip between a caregiver and a patient that they can take, and you can help to free up and make it so that you don't need that whole $2,000, then
Yeah.
that frees up maybe another thousand that can go toward another patient more frequently who doesn't have the ability to connect with, say, Angel's Flight or Host for
Yeah.
Hospitals or Extended Stay America is through the American Cancer Society that I found them this summer. Like there's so many resources out there, and we're going to do our best to connect you with as many of them as we can. But
Yeah.
like I said, if you guys know of more, please tell us. We want to know and we want to
Yeah.
spread the news.
Yeah. Thank you so much, really,
Yeah.
for doing this because I think had I not had this Aflac plan and I would have sat down at the kitchen table with my husband to say, okay, what are we going to do? I don't know that I would have, I think I would have hit the pit of despair.
Yeah.
I do have people who, when we talk to them, and I know y'all have this situation too, when we're able to help somebody and they are completely blown away that this part of the equation has been handled for them. The emotion behind it, the relief is significant. You know, I've had people who have said we were literally sitting here saying, how many months can we go without paying our mortgage? Because we're going to have to pay this is equal to a mortgage payment, and we don't have the money for both. And to hear that our foundation and that your foundation and things like that could actually help is significant. And the Kristen Fox Foundation, you know, their motto is you're not alone. You're not doing this alone. And I think we all feel that way. That we all want to just hold each other's hands and say we're going to get through this together. The other thing is, you know, and this has been really, I'm going to be very transparent about something that is hard. My mother had breast cancer and is a survivor. And so this is not a bump against like breast cancer month, but I was just going to use it as an example. There's so many resources for breast cancer. And I'm so excited and I want it to be that resources for my mom that we were able to use. But sometimes I'll see that and I'll be a little envious. Like I'm like, nobody's wearing blue and black socks for me in the month of May and everybody's wearing the pink socks, but I don't mean that bad. I'm just saying when I look at the resources that are available and what we have in terms of resources, it's vastly different. And so we want people to know that there are resources for ocular melanoma, specific to ocular melanoma, and we want people to know out there who want to help in some significant way that we don't want you to deter giving for breast cancer or for colon cancer or whatever. But this is a unique niche of people, like you've said, that really could use your help. So if there's anybody that somehow sees this and is like, I'd like to make a difference in the world for somebody, you can make a difference here in the world of ocular melanoma and helping people travel for life-sustaining and life potentially saving treatment to get people to a clinical trial that can make a difference in 10 years from now. You know,
Yeah.
that's significant. And we're very proud of what we do. It's extremely humbling to see what we do. And, you know, I say it's so wonderful that I have something positive to focus on every single day. I don't get paid to do what I do. Melody doesn't get paid to do what she does. And we pay our administrator and then that's it. And so we just take a lot of pride in what we do, but there's a lot of humility in that we couldn't do what we do without the support of other people. And y'all are the same way. And so that's why I think we collaborate so well, because when people talk to me and they're like, I don't know anything about this, I'm like, go to Kieran's site. They will give you the information.
And here's all the resources. Danae and
Here's
Megan have been on YouTube for years.
exactly,
We've
here's their
got
YouTube channel.
thousands of videos for you.
It is phenomenal how I think it's all coming together. So thank you for doing this today and for bringing it to everybody's attention. I think it's going to spark a lot of unique conversations, and I think it's going to be great. So thank you.
Absolutely. Well, I couldn't have said it better myself. Ashley, thank you so much for being a guest on the I Believe podcast yet again. I just want to give a plug to our sponsors who make this podcast possible. We are supported by Castle Biosciences, by Immunocore, and by Delcath, and by Aura Biosciences. So thank you to our sponsors for making sure that we have the ability to get these resources out to patients. Please consider making a donation, following us, and subscribing on our YouTube channel or on the podcast platforms that you follow. And take a look at the resources in the comments and just stay tuned for that resource PDF that I'm going to make accessible to everybody listening to this episode, and hopefully you guys can just share it far and wide. And this will really make a big I don't know if you guys have heard the idea of like a ripple effect, right? Like the pebble goes in the pond and the ripples just keep going, right? And if 2 of you share this video, or 2 of you share the PDF that we're going to have available for you, and then 4 more of you share it, like just imagine the reach that this will have, and being able to share and pay it forward to other patients, pay it forward to other families. So Ashley, thanks so much for your passion, and we will talk to you guys next time.
Sounds great.